There was some great talks. Jennifer Goldman, talked about the importance of, an interdisciplinary team and integrated models of care are definitely needed, given the complexity of Parkinson's disease. It's just, we know the sort of the complexity, the diversity of the symptoms takes an expert team. So I think she was really trying to highlight, the importance of this team and, to get the team in place early. And, she highlighted, a growing body of evidence supporting better outcomes with the team approach to the management of Parkinson's disease. And so I think there are many effective models that she highlighted, and, the models might differ depending on the country, that has to fit into the particular local healthcare system, to make it work. But there are many effective models. And then Dr. Mark Gutman, he talked about the role of telemedicine. And we planned that talk way before COVID-19. But it turned out to be very timely. He has lots of experience in providing care to people with Parkinson's disease using a telemedicine approach. And, he was able to talk about in Canada, where he is, about the importance of reaching people that are far away. It allows people to really access expert care at expert centers, centers of excellence. And he really talked about some of the pragmatics. He's got a very well-oiled machine there. Lots of processes in place, to make it more fluid and easier to implement. And, he talked about how effective this can be and, really cuts down on the, travel that's necessary, the burden associated with visiting, a neurologist. But, he did talk about, he likes to see people at the beginning, at least the first visit, or meet people in person. And then it's kind of a nice hybrid model, so that you can have some in-person visits and some that you can continue remotely. So, and then Maya Katz, she talked about this sort of palliative care and the importance of this approach. And, really she kind of highlighted the importance of introducing this early and the benefits of providing that extra support to people and to helping them plan and to helping them, set expectations and to be more aware of what their future holds. But, she nicely talked about how to individualize this to really meet patients where they are and to provide the information that's going to be most helpful to them and, and their families. So, and she provided, some data from some recent trials showing better outcomes, with this approach. So, she was a great resource in this area.